Hello and welcome. Thank you for joining today's webinar entitled Design and Methods of Natural Experiments in Transit and Physical Activity. My name is Chad Spoon and I'm the Communications and Partnership Manager at Active Living Research. I'll be the moderator for our webinar today. Before we start with the presentations, I want to review a few housekeeping items to let you know how you can participate in today's session. Here is a screenshot to show you an example of the attendee interface. You should see something that looks like this on your own computer desktop in the upper right corner. By default, you are listening to the webinar through your computer speaker system. This means if you can hear the music through your computer, you'll be able to hear the presentations. If you would like to listen using your phone, just locate the audio pane and select telephone. The dial-in information and access code will then be displayed. All lines have been muted, but if you have the ability to ask questions using your questions pane, simply type in your question and click send. At the end of the presentations, we will do a Q&A session and take as many questions as we have time for. Today's webinar is the second of 3 web forums that Active Living Research is holding to cover important issues that researchers face when studying physical activity and the built environment. We held our first webinar in November on pre- and post-studies in parks. Our final webinar will cover designing and conducting research on policy implementation and will be held next week on December 17th. We've included a registration link to that webinar in the questions pane now. A recording and/or slidings from each of the 3 webinars will be available at activelivingresearch.org/news-and-events/archives. First, we wanted to give you a brief overview of the program Active Living Research. We are a program of the Robert Wood Johnson Foundation that uses evidence to prevent childhood obesity and create active communities, especially among youth in low-income and minority communities which are at highest risk for childhood obesity. We focus on the translation and dissemination of research to inform policy debates and guide the development of effective solutions. Our website has a library of research briefs, infographics, presentations, and tools and measures that you can use to make the case for healthy schools, parks, and communities. Our mission is to partner with stakeholders to apply the lessons of research to build great communities. Today's webinar will feature 2 leading researchers who will discuss the design and methods of conducting pre- and post studies around changes in public transportation infrastructure, the challenges that can arise when conducting these studies, lessons learned, and recommendations for other researchers who are looking to carry out their own pre-post study. First, we'll hear from Brian Saelens. Dr. Saelens is professor at the University of Washington School of Medicine. His research interests include obesity treatment and prevention, especially examining environmental factors and policies that influence physical activity and eating behaviors in children and adults. On today's webinar, Dr. Saelens will focus on integrating measurements to obtain assessments of transit-specific physical activity, cross-sectional versus longitudinal finding differences, and case control selection. Second, we'll hear from Barbara Brown. Dr. Brown is professor of the University of Utah Department of Family and Consumer Studies. Her research relates physical environments to important outcomes such as physical activity, BMI, and neighborhood perceptions such as fear of crime. Her talk today will discuss the importance of using objective measures of activity such as GPS and accelerometer measures. So with that, we will turn it over to our first speaker, Brian. Go ahead, Brian.
Thanks, Chad, and thanks, ALR, for inviting me to present and for ALR for hosting this webinar. Today I do get the opportunity to talk about some of our work examining the link between transit and public transportation. And we want to specifically talk about some of our experiences around design and measures considerations in our track study. So why would we be interested in examining transit and its relationship to physical activity? And particularly, why would we be interested in natural experiments or quasi-experimental designs to examine this relationship? We'll lay out some of the rationale and the existing evidence for links between transit and physical activity. I want to highlight some of the threats to the conclusions about whether better or more transit necessarily would increase an individual's or a population's level of physical activity. and then discuss some of the case and control definitions, sampling, and recruitment issues we ran into, and then discuss some of the measures decisions we made and lessons we learned from that process. So here is a good depiction of why we in fact might expect there to be more walking or physical activity as a result of taking transit. So in this figure, you can see on the left-hand side, there's an origin where people start their destination, start their trips from, but they often have to walk to get to the nearest transit stop, and that's walking that would be considered physical activity. And in the middle part of the figure, you see all the transit activity that people are incurring, and then they get to their final transit destination, and they have to walk to their destination, though. So here's an opportunity throughout transit, throughout one's day, to get more physical activity as a result of taking transit. Oh, whoops. And in fact, people have explored in nationally representative studies whether people get more physical activity as a result of taking transit. So here's data from the 2009 National Household Travel Survey, and it looked at total daily walking trips times to and from transit in the US in 2009. And here we find about a median of about 21 minutes of walking associated with taking transit during the day. We've got some folks on the low end who aren't taking much walking at all, and some folks at the very high end, but the median is about 21 minutes a day. Now on the physical activity side, if we got an intervention that got a population to be 21 minutes more active each day, we'd be quite excited about that intervention. However, it's not an intervention, and we need to move from the travel episode framework to more of an individual level framework. And by that I mean, if we're interested in improving the population's overall level of physical activity, we need to understand transit's influence at the person level. Now, there are multiple types of designs and strategies to examine the possibility that transit is associated with physical activity, and more specifically, whether those who use transit are more active than those who don't use transit. And in fact, with increasing specificity in our measurement, I think we can get even closer to the answer about whether transit use is related to physical activity, and more importantly, feel more confident in suggesting that increasing transit use might actually increase an individual's or a population's level of physical activity. However, there remain threats, though, particularly to a lot of these cross-sectional designs, including the issue of self-selection or potential third variable confounding. Now, self-selection is the idea that one selects into one's neighborhood or environment based on wanting to be active, and taking transit and engaging in physical activity to and from transit is just an expression of that underlying predisposition. I mean, it's interesting, this comes up in our scientific reviews constantly, and even policymakers ask me this question of, well, aren't the people going to take transit the people that are predisposed to being active anyway? And they're not even steeped in the science in the way that we are. Alternatively, it could be that transit access is not random and tends to co-occur in environments that are more supportive of utilitarian walking. So transit use is merely a proxy for better walkability in an environment, and thus it's not surprising that transit users who live in those environments are more active than non-users, because their environments are different in ways that are related to transit access. And finally, with cross-sectional studies, we also are concerned about the possibility of substitution of certain types of physical activity for other types of physical activity. I walk to and from the bus today, so maybe I'm not going to go to the gym or go on my usual walk, my post-dinner walk around my neighborhood. And that would be maybe not a detriment to overall physical activity, but there'd be a substitution there that we would worry about. So let's take a look at an example of one cross-sectional study that did examine the relationship between transit use overall and physical activity. So in this study, on the y-axis, this is an estimate of daily physical activity based on accelerometry. And in the first three bars, we see a difference between people who are non-transit users, infrequent transit users, and frequent transit users. And in this study, frequency of transit use was based on the frequency with which people commuted to work via transit. In these two bars, the dark purple bar and the white bar, we can see that in both these instances, infrequent or frequent transit users had significantly more daily physical activity than non-transit users. And in fact, if we split up this sample into folks that live in good built environments for walkability and poor built environments or low built environments for walkability, we still find a difference between transit users and non-transit users. In that transit users were getting more daily physical activity overall than non-transit users. We can even go beyond that, though, and start to break down physical activity into its component parts. So this is a different study we did where we compared non-transit users to people who infrequently took transit use, kind of moderately took transit use, and then were high transit users, such that more than 60% of the days they did assessments on, they were actually engaged in some kind of transit use. But instead of just looking at overall physical activity, in this study, we were able to break down physical activity into its component parts that might be related to transit. So the things in yellow on this graph are non-walking physical activity amongst the non-transit users and the different transit groups we have. And in fact, there's no difference between these four groups in the amount of non-walking physical activity that they got. And indeed, there was also no difference in this group in the orange bars in their non-transit related walking. That was walking that didn't occur any time around transit. It wasn't temporally linked to transit in any way. And again, there was no difference in the amount of non-transit related walking between these four groups. However, there was a difference in the transit related walking. Not surprisingly, the non-transit users didn't have any transit related walking. But as you increase the frequency of transit use, you increase the proportion and the amount of time people were actually engaged in transit related walking. And here we're getting a little bit closer to this idea that transit use might be promoting more physical activity. And in fact, the high transit users, people that were that were taking transit 60% or more of their days, had an additional 15 minutes of physical activity that they weren't substituting in other activity for that was directly related to transit. And we could take this even one step further. We know that transit users are not consistently transit users every single day. So we can look to see whether their behavior of the same individuals varies between days they use transit versus days they don't use transit. And this is especially helpful because then we can control for those individual level factors and predispositions that we might be concerned about confounding the relationship between transit and physical activity. So here's that same study. Here's the non-transit users again, getting no transit-related activity, but getting some walking that's not for transit and getting some other physical activity. If we looked at our transit users on their non-transit days, so breaking out those days where they didn't engage in transit use, they in fact looked exactly like non-transit users. Same amount of physical activity overall, same amount of walking behavior, same amount of non-walking physical activity. But when we looked at transit users on transit days, they still had the same amount of non-walking physical activity, same amount of walking, non-transit related. And again, that 14.5 to 15 minutes of walking behavior that was directly related to transit. Again, a little bit more confident that transit's driving this higher level of physical activity. Other folks have found these relationships as well. Rizzo, in a study published in 2012 in a review, looked at 27 studies and found that between 8 to 33 minutes of physical activity was directly associated with public transportation use. And several of these studies actually landed in that 12 to 15 minute estimate that I just talked about. And they estimated that about 10 to 29% of the population would actually meet the recommended 30 minutes of daily physical activity for adults just by public transportation related walking. This is great. However, when we talk to decision makers about this, what they want to know is not only is there a relationship there, but you actually increase physical activity at an individual population or population level when in fact you invest a bunch of money in transit and change transit infrastructure. Does physical activity or health actually improve? Hence our attempt to understand the impact of opening a new light rail line in Seattle in 2009. This is a natural experiment in which an environment changed. Light rail was opening. We didn't have it beforehand. After July 2009, we had a segment, I would call. And this is a natural experiment in that we evaluated folks over time and compared the differences between folks who were living close to the future light rail stations and folks that were matched in their demographic and built environment characteristics in the rest of our county. And we examined behavior change in response to this environmental change. We tried to use the best possible set of methods at the time to assess physical activity in its context. And this is a group-matched cohort design, and that we did similar assessments with the same cohort of people before the light rail line opened, 1 to 2 years after the light rail line opened, and then 3 to 4 years after that. So if folks are visual, this is what we did. We wanted to see whether this opening of this transit line, a light rail line, resulted in more physical activity. Like I said, this is a group-matched cohort design. We tried to select, and we did select cases as adults living less than 1 mile from the future light rail station. Our controls were adults living in the county, living more than 1 mile from the future light rail station. And I'll refer you to Anne Moudin's report on this to look at the number of various demographic, transit service, built environment characteristics that we tried to match these folks, or at least the block groups in which they lived, to make sure that we had good control and not confounding later on. So here, if folks are familiar with the Seattle area, the things in white, over here, that's water. This is Seattle. This is the rest of our county. Our dark census block here these are the blocks that were cases. These were census block groups that had individuals that lived within a mile of this future light rail station. And then there were eligible block groups for control block groups in the rest of our county. And when you looked at who we actually recruit, this is where we are. All the purple dots are people who recruited for this study. The folks that are close to the red dots are our cases. The folks that are purple dots elsewhere are our controls. So ultimately, how did we do with our sampling? Did we find that we had similarity between our cases versus our controls? And in fact, we did. The average age of our participant is about 51, 52 years old at baseline. We had about 2/3 women, 1/3 men. Household income was very comparable between our cases and controls. The only significant difference between our cases versus controls is our cases were actually more likely to be non-white or Hispanic. And that's actually quite reflective of the corridor in which the light rail system was set. So it wasn't surprising that we found a difference there. But perhaps most importantly, there was no difference in the amount of physical activity, whether looked at continuously, whether looked at with higher standards for what's moderate physical activity, looking at walking minutes, looking at walking bouts. They didn't differ between our cases and controls. And in fact, the transit use at baseline, and this was all bus transit at this point, didn't differ. And in fact, about 40% of our sample were transit users. Some of them were quite frequent transit users, but about 60% were not. So how did we do around built environments? And in fact, we found no differences between our cases and controls on baseline built environment. Our participants' neighborhood, defined as an area within a half-mile radius of their residence, contained about 539 acres, and this is a very urban sample, right? So there were about 6.3 dwelling units per acre in this area. You could tell this is Seattle because we had about 4 coffee shops within a half-mile of most of our participants on average, a fair number of intersections, and a fair amount of street grid. And we enrolled these participants at baseline, and we tried to follow them a year to 2 years later and 3 years later. We lost some folks so that we had about 75% retention by our 3 to 4 year time frame. And in fact, most of the folks we lost were folks that had moved out of their area, out of their neighborhood, and were actually no longer eligible for the study. What did we learn from the sampling, recruitment, and retention? One was certainly to engage built environment experts to match as best as possible. So this study is in collaboration with Anne Moudin and the University of Washington Urban Form Lab. We need to engage these folks to help us match on very important variables that go beyond demographics that we're used to matching on. Having baseline built environment, transportation service, other variables that are important to match on was critical, I think, to our success. It would have been ideal if we had better penetration into our neighborhoods, into recruiting a more representative sample. We relied on public information and public records information to do recruitment, and generally just landlines. I think that limited the generalizability of our sample a little bit. We did need to incentivize creatively, and I think that's one of the reasons why we actually were able to maintain our sample pretty well in the long term. Our incentives range from about $100 to $150 to do all the methods at each time point. And we actually incentivized people to getting our devices back quickly. We gave an additional incentive, and our IRB was fine with this, to provide participants with an incentive to get us devices back quickly. And very challenging to do, but try to double or triple your anticipated recruitment timeline. Start early and as early as possible. One of the things that's very hard to do with these natural experiments is you don't control the timeline about when the infrastructure intervention happens. And our light rail was right on time. I want to dive into a little bit of our track methods because this is something I think that really was an important contribution to our work. We have 3 time points. We did baseline, near post, far post assessments. And we deployed devices and a travel log to try to be able to get a better measure of physical activity, and particularly transit-related walking. So at each of our time points, our respondents wore an accelerometer, a portable GPS, and filled out a travel log for 7 days. So if you do that, our hope is that via the timestamp that exists on the accelerometer, the GPS, and the travel diary, we'll be able to integrate that and extract from that information about walking and the context of which walking happens. And I'll refer to Phil Hurwitz's excellent publication in the Frontiers in Public Health to explain this process in detail. So we have accelerometry data, we have travelog data, and we have GPS data. And in fact, we can integrate that data. And on these slides, you can see the top bars here are what the travelog is telling us. The blue bars are what the accelerometer is telling us. And the purple or cyan bars are the things that are, the GPS is telling us. And I'll go through this first example just to highlight how we actually extracted what we consider some of the walking trips. So here, this person responded that they were at home, but in fact their accelerometer suggested that they were moving. Their GPS suggested they were actually moving outside their home and moving at a speed that was consistent with walking. So we considered that walking behavior. So again, if we just relied on the travel diary, we would have missed that walking bout. But the integration of the travel diary, the GPS, and the accelerometer allowed us to get a better estimate of the overall amount of walking folks were engaged in. And in fact, we're quite glad we did this. When we just looked at travel diary alone, it was underestimating our walking trips by about 40%. One of the things the GPS does and the travel diary integration does also allows us to get at that estimate of transit-related walking. So if we have walking bouts identified by our GPS and our accelerometry together, we can link that with our travel diary. And when folks report a bus trip or some kind of other transit trip, we can identify whether walking behavior happened before or after that trip, and then assign to see whether it's we consider that transit-related walking. So for example, in this example, we had a respondent who indicated they had a bus trip. We looked for walking trips before and after that bus trip. We found a walking trip based on our GPS and accelerometry integration before and after, and we considered those transit-related walking. They also recorded a walk trip later on, and our GPS and accelerometry integration suggested there was a walk trip, but it wasn't anywhere around a transit trip. So we considered that non-transit related walking. We think that our cross-measure integration was helpful in obtaining better precision and more information about what physical activity happened, where it happened, and it also allowed us to carefully examine how people were actually engaging after the light rail was implemented. I would suggest we need to carefully examine our data, even beyond descriptive analyses, when we get these devices back. There are known limitations we need to know the limitations to our devices. One of the issues that we ran into, I'm sure others have as well, is our accelerometry doesn't understand daylight savings and our GPS does. It's an important thing to adjust for that when you're shipping out devices before and after those time changes. You have to have ongoing vigilance from your staff when you're getting this device information back. We recently encountered GPS devices that were actually backdating. And we think what the issue was that they actually weren't being cleared and as a result of reinitialization once they came back into our offices. If you're just relying on the devices and you think that's going to be completely accurate information, I would encourage you to have vigilance around your device use. And lastly, we need to find a better way to distinguish between utilitarian and recreational walking. We're going to publish a few studies coming up looking at how we define those things using GPS and accelerometry and travel diary, but I still think we need to work a lot on that. I notice I'm running short on time, so I'm going to skip over that. One of the things I think that Barbara is going to talk a little bit about is how you define cases for these transit-related studies. We actually did a quick peek at some of our longitudinal data a few months ago, trying to understand whether we saw changes in walking from baseline to our near post. And we didn't see a lot of change amongst the folks that were living near light rail if we define case as that mile distance. When we started to break down that mile distance, we did start to see differences in the amount of overall daily walking between people that live very close versus moderately close versus a little bit farther away, but still would be considered a case in our study. I want to acknowledge our funders. This is a study funded by NHLBI and TransNow, a local transportation organization, and Renee Madun and her excellent colleagues at the Urban Forum Lab, my excellent research staff, and I'll conclude there.
Okay, thank you very much, Brian. That was a great presentation. We do have one very quick just follow-up question that came through that's very relevant for your presentation. Just for the track study in Seattle, did you use crow fly distance or network distances when you were selecting case control participants?
Yeah, that's an excellent question. You know, the block group selection was based on crow fly distance because it was a block group selection initially, but then we will go back and later look at network distance as well. And network distance is probably the most applicable one, right? Because that's the way that people are actually going to access transit. So we will look at both. We initially defined, I think, based on crow flight distance, and that was probably a mistake. We needed to do network distance in order to get a more accurate representation of who was close enough to those future light rail stations.
Great, thank you. So with that, I think we will move to our second presenter, Dr. Barbara Brown. And I am switching to your screen now.
Do you see it now?
Yes.
Great. Good morning, everyone. I'm happy to talk about the questions that you might want to be asking if you are considering doing a transportation intervention study. And I'll be using some illustrations from my own Moving Across Places study. I will start with a quick description of my MAP study in Salt Lake City, where we looked at an extension to the light rail line, and then address transportation questions you might want to ask yourself if you're considering doing this type of a study. Here's a quick peek at our study site. This is the before picture. You'll see no tracks light rail, no bike lane, lousy little sidewalk here. After, they improved it, nice, wide, pedestrian-friendly sidewalk with landscaping and pedestrian lighting and a bike lane and light rail tracks going down here. And we had the kind of design that Brian was just talking about. We were looking at whether people living near the new light rail lines, stops going in, and the bike path and better sidewalks were more likely to take advantage of those features compared to people who were further away from the intervention site. And we were able to compare both before and after the complete street intervention. We used activity and travel measures from GPS and accelerometry. So our participants wore these devices for about a week before and after the complete street. And the GPS can track activity, especially outdoors, and the accelerometers can give you physical activity intensity measures. And this is just one peek at our results. We looked at those who changed their transit use over time or didn't ever change their transit use. And these are changes in the accelerometer counts per minute over time. So you can see that people who never used transit didn't really change from one year to the next, the amount of activity they engaged in. Same with continued, as you'd expect. They haven't changed their transit use, so it's pretty constant. But here, as you might expect, those who stopped using transit lost daily physical activity, and those who started using transit gained healthy amounts of physical activity. Now, I know these accelerometer counts are kind of arbitrary units, but this amount in the 40s is about the difference between being overweight and obese in terms of daily physical activity. So it relates to meaningful health differences. So as you consider doing these studies yourself, you will ask yourself a bunch of questions that Brian and I have already been through. First, do you need accelerometer measures? Well, I've always been shocked at this report from Troiano looking at the N. Haynes data, where about half of us say we get sufficient physical activity, 150 minutes a week in bouts of 10 minutes or more, but less than 4% actually do when you look at the accelerometer measures. So I think that this is a good pitch for getting some type of objective measures of physical activity, you know, if not accelerometers, certainly pedometers. Do you need GPS measures? Well, only if knowing about outdoor locations is important. In our study, for example, we wondered if more PA amongst transit riders might be because they are doing physical activity in the neighborhood around the transit stops, because these places often have shops and services, or is it the walk to the transit and taking transit that is accounting for their physical activity? So with GPS data, where you can identify mode of activity, both walking and transit use, you can separate out these potential sources of physical activity. So I believe that GPS data can be very useful to tie activity to place or route, and that makes it ideal for examining new infrastructure. Another question you might ask yourself is whether you can do this in-house. GPS data, I had never collected GPS data before this study, so I was reluctant to take on the responsibility for doing the GPS data. And when you can think about it, the data just flood in. You know, GPS points every 3 seconds can be collected. Accelerometry, we get 10-second epochs downloaded. You add that to any survey components you have, any counting of pedestrians that you have, any auditing of physical walkability that you have, and you're just flooded with data. So we happily chose Geostats, which is now with WetStat, to take advantage of their experience with integrating GPS and accelerometry data. And they also took on the calculation of what type of travel mode was involved. This is very time-consuming work, doing the mode designation, so just be aware that you don't really have a lot of time to make adjustments between your time 1 and time 2 data collection phases. So you have to be happy with your measures as you start in the field. Another question that you might want to be asking yourself is whether the target intervention you're considering will actually increase physical activity. It seems like, you know, it's an easy kind of question to say, sure, any infrastructure is going to increase physical activity. But I don't find that to be always the case. So I always urge people to really get to know your possible sites. We, on earlier studies, had done a lot of site visiting and vetoed some prospective rail stops to study. You know, if they're surrounded by big park and ride lots and fenced off from the local neighborhood, then that site itself is probably not going to inspire a lot of physical activity. You're going to spend a lot of time on this study, so I urge people to find a site that is going to translate into walkability or physical activity improvement, and to make sure you're happy with that decision before you start the study. Now, I'm going to take you down a little bit of a geeky path here about how you select your near and far areas. If you were going to be doing a study that compares near people who are exposed to a new path or bike path or rail line compared to far areas that you consider as control areas. When you consider it, we had actually 3 active modes to think about. People could walk to the tracks light rail. People could walk along that nice new sidewalk. People could bicycle along the new bike path. So we had to define one group of nears and fars, and we chose to focus on the light rail access, which we thought might be the most popular, the most ambitious intervention. And if you look in the literature, you know, there are several suggestions about what constitutes exposure to a new light rail. How, you know, where will people walk to the new rail? Some have considered half a mile distance. Others suggest slightly longer, kilometer. We chose the 1 kilometer distance as near, which provided somewhat similar near and far samples. We did have some differences in that nears were lower income and such, but we are controlling for those differences in subsequent studies. Here you see our ugly map of the neighborhood, and it shows you that even amongst nears, you should expect variability in access to the transit stop. So if you are near this transit stop, lots of different residents can be drawn toward that stop. But as you look at stops elsewhere, because of layout of the neighborhood with industrial land here and parkland here, the access is quite variable. And we were only studying 5 new rail stops, so you need to keep these kinds of limitations in mind when you're considering near and far. And it's not just Salt Lake City where you see that happening. Here's an older example from Calgary that shows that there's a lot of variability in walking access to light rail stops. And, the access here varies twofold. And in this case, it was because the stops on the periphery, people would walk longer to them because that was their only choice, whereas in town, they might have a choice, a closer stop to consider. And this is consistent also with what you find in variation to walking to light rail globally. Here you find a threefold difference between access to rail in Calgary versus Perth. So think about the researcher who has to pick what is near and what is far, given these differences in walking distances to rail. Your choice is going to matter. I made up some data here to illustrate this. If you set your far boundary too distant, then any near effect you get, if it dissipates quickly, may wash out your difference between near and far. If you set the far boundary too close and the effect is continuing beyond that arbitrary boundary, then again, you can have an average no difference between far and near. So you need to define far to plan your sampling, but expect to test multiple distances and to be sensitive to how those distances vary, just the way Brian did in the end of his presentation. Here's my data. Here you can see what the distance effects were for walks to transit. They peaked within a very close distance. This is hundreds of meters away from the intervention. This is the proportion of people taking transit walks. So the effect is really limited to very close proximity to the complete street. We can look at a different type of access. This is non-transit walking, and it falls off less sharply. So near and far may differ for these two different modes of transportation. Given that both of these slides that I just showed do in fact show an effect of exposure to near transit, one might think, oh, it's easy to get these near effects. But I want to caution you against that, because I've had a lot of people come up and say, well, duh, if you have somebody living near a new bike path or walking trail, of course they're going to get more activity. But I don't consider these effects a slam dunk. When you look at pre-post walking path studies, there are very few studies that actually say that exposure to a walking path increases walking by nearby residents. The last review on this showed that we have a hard time getting longitudinal studies launched at all. Only 3 of 52 were longitudinal, and no increase for near pedestrians in the 3 intervention studies. But we know that from a correlational perspective, proximity to rails is correlated with more use. So we clearly need to learn more about how to tease apart correlational versus longitudinal findings. And maybe distance, the way distant, near, and far is set might account for some of it. Selection effects over time might account for some of it. So if you are thinking of studying new bike lanes, you have some special challenges to contend with, especially if you're in the US. In the US, biking is rare and sporadic, with few people commuting to work by bike, and biking is not stable over time. So few studies have found the hoped for near effects. Here's what our data look like, and as you can tell, we're happy that we didn't anticipate a strong effect for nearby cycling since we didn't get one. Again, it just underscores the point that cycling is rare and it's spread out thinly across the population, so it's hard to get those near effects. So if you really want to study biking, what would we want you to look at? You could sample only cyclists. This is one of the few studies that actually found that near cyclists increased their biking over time once a nearby path was completed, and far cyclists actually decreased their biking over time. You can also screen for bike owners to increase the likelihood that you'll get biking in your study. Jennifer Dill did this and found an amazing 40% of people biking in a week as measured by GPS. Unfortunately, there was no increase among near cyclists near a new greenway. In addition, you might want to, if you want to make sure that your biking study is going to work, you might study it abroad where biking is more common. So there's lots of evidence that there's health effects for adult cycling in Western Europe and China. And then finally, you can observe cyclists on new bike paths instead of trying to find people in the surrounding neighborhoods to do surveys beforehand. And a number of these studies will show that if you build a new bike path, it will attract new cyclists. But what's not really clear from these studies is, are these in fact new cyclists, or are these cyclists who used to ride elsewhere but have deviated their paths to take advantage of the new bike path? So I'm going to end on some tips from the field. Intervention and timing issues are rampant. Brian's one of the few people who said everything was on time for his light rail study. I rarely hear that. Instead, I experienced a surprise intervention. My pilot study of studying new light rail stops was dumped in my lap over lunch. Luckily, we heard about a new stop coming up, and we could have easily missed that. And I got valuable pilot data that I think paved the way for the R01 that I had to study the additional light rail line. So keep your network alerted to your interests because there are community interventions all the time. Stalled interventions are much more common, I think. I'm just giving one example of someone who wants to evaluate a new busway that has a walking path, and the construction is delayed for 2 years, which really makes it difficult. But they were able to test in staged phases, so you may have to consider that kind of fix for your study timing issues. Another problem is earlier than anticipated interventions. This happened to me. I had this nice timeline laid out, plan A, for my study, where rail was going to start at the end of the summer, beginning of fall in 2013. We don't collect winter data in Salt Lake City. Then we were going to get time 2 in spring, but the rail started earlier than we anticipated when we wrote the grant proposal. So we had to decide, do we move up the time 2 spring data collection or keep it later? If we keep it later, we have lots of people moving away. If we go early, we have little exposure time to the intervention. So we just gambled and went with an early time 2. And it seems to have worked for us. But who would have known? Maybe it wouldn't work. And then incomplete interventions. I've heard about these where you have the staff hired and trained, and the big interventions that are supposed to happen, like a park that gets new sidewalks and benches and trees and this and that, the people tell you, oh, we can only afford to do half of that. So if you have an intervention that's less grand than what you had wanted to look at, you might need a bigger sample size to detect a smaller effect. And then other tips, we did door-to-door recruitment, and we found it useful to get a letter from the police chief to assure people we weren't trying to sell them anything, we were actually doing surveys. And then we had locked condos and apartments that we could not recruit at. So we had to spend a lot of time of managing, snack table outreach in some of them where they'd let us in to meet the residents. But in another, we were denied access, and I've never been denied access to a locked unit ever before. So that's something to be concerned about. And then finally, a couple of articles, one from Brian's group, were very useful in these nitty-gritty kinds of issues about planning your sample sizes and other kinds of things and recruiting techniques. So I would recommend anyone doing a transportation intervention study to look at these. And then here are my references, and that's it.
Great, thank you very, very much. We had one question that came in that I think that is great to address now, just very quickly. Can you tell us a little bit more about the time frame between, in the very beginning of your presentation, you showed the two photos of the before and after of the complete street intervention. And could you tell us what the time frame was between the before and the after?
So the before, we actually took advantage of some warm winter weather and recruited from about April to early December in the 2012 before. And then after, we had a couple of people moving who got in touch with us, so we actually started them May just so we could get them, but most of the data were June to November afterwards. So, that was a concern of ours because at most that we had like 7 months of exposure to the intervention at the time too.
Great, thank you. We had one quick request. Could you just pull up your slide 28 again, the one previously, the two citations for how-to details again? Someone was asking to, I think, write those down. Thank you. And just a reminder for those that are our attendees on the line, if you do have a question, we're going to be just momentarily beginning our question and answer time. And for even any of the questions that we don't get to today on our webinar, we will collate those questions and have our speakers respond to them briefly and we will be posting those with the recording of the webinar on the Active Living Research website. So even if we don't get to your question now, we should be able to get a response to it. So with that, I think we will go ahead and open up the question and answer time. All right. Let me just sort through some questions real quick. This seems like a question possibly for both our speakers. How would these studies address differences in baseline built environment characteristics between the intervention and comparison residencies? Often these studies don't have power to test intervention interactions with built environment characteristics, such as population density or other amenities.
Chad, I can take a step at that first. So we actually tried to do at baseline a match in the baseline built environment between our case versus controls. Now it's going to be imperfect in part because it's hard to find within any given region the same built environment characteristics in a place where they might be doing transportation improvements or changes in infrastructure. So at least on the variables that we looked at and the variables that we attempted to match on at the census block level for sampling, we found very little differences between our cases versus controls. Although we did find that our cases, once recruited, were much more likely to be non-white or Hispanic. So, and again, that's a reflection of that corridor. It's a much more ethnically diverse corridor than the rest of our county. And so we found those differences in our cases versus controls. But for, and I think that's one of the things that I certainly learned in kind of having a health perspective is the importance of trying to match on those baseline built environment characteristics. And hopefully we'll have the power to look at a few interactions between baseline built environments, but there's very little difference at an average level between our cases and controls.
Great, thank you. Barbara, do you have anything to add? Or?
Yeah, for me, we looked at some census SES data, and it seemed like our FARs were about as similar as we were going to get. And another consideration for our study is that we really wanted to look at the walkability to the track stops. And so we did the Irvine, Minnesota inventory of walkability for all blocks of all people between their home and the track stop. And so we you know, for that reason, we were not spread across the entire city looking for distant matches.
Great, thank you. This one may be for you, Barbara. On near-far designation and the correlation slam dunk question that you were dealing with, has anyone, do you know of anyone, if anyone has studied nearness of origin and destination? For example, this particular person says that she lives near a nice bike trail, but her work is not accessible by trail.
You know, I think that feeds into my sense of is your intervention going to work? And my concern is that a lot of new trails are put in areas that are convenient to buy cheap land, or, and they don't really connect a lot of destinations. So I agree that that can be a concern. I don't know of anyone who has looked at proximities on the front and back end of a bike trail, but I can understand that that is a concern, that the trail doesn't want to go where you need to go.
Great. And this next question is for both our presenters. Do you usually go through all calibration steps before each data collection using GPS devices?
Yeah, this is Brian. We do certainly do that more often now that we've seen blips in some of our GPS data. I mean, the challenge is, particularly at baseline, trying to get this stuff pumped out so quickly, and trying to make sure that your devices are working well and that people are getting devices quickly so you can get the data. So we do more of that now than we used to, but probably still not the perfect process.
Yeah, and we had a time that we were wearing the devices and testing them out before we launched into the field. And in our study, we actually went to people's homes and downloaded the devices in their homes. So if we had insufficient wear, for example, we could ask the people to wear the devices longer, so that that was less of a problem for us than a study that has a mail-back feature.
Great. Here's a question that I think that particularly coming from active living research, where we focus on using research findings and getting them to policymakers and practitioners, someone was asking, this is a question for Barbara, can you let us know how, if any, local city planners are using the data findings in Utah?
You know, I've been so immersed in getting the findings out, I haven't collaborated as much with the local officials as I should have. But for those that I talked to, they have been following this with great interest. And you know, the mayor gave me a letter of recommendation for the study and is a planner and is quite interested in these results. And I think there are enough people in our locality in the health department who are talking to UTA, the transit department, that they are eager to figure out how transportation can be seen as a health intervention as well.
Great, and this next question kind of piggybacks on that, and maybe both of you can elaborate. Someone's saying, if you have a community intervention that is coming up, how and to who should you be contacting that might be interested in the research?
Yeah, we have a current project that's similar design to what we talked about in our track study that's looking at bus rapid transit. And we contacted our transit agency and said, hey, is this something you guys want to partner on in doing evaluation? And they were more than happy to do that. And so to me, that was a helpful outreach to them. And we also loop back then to our public health folks because they're interested in the health side of this.
And I did the same for my study. I think the UTA people were tired of hearing me saying, when is it going to open? When is it going to open? But you really need to stay on top of those kinds of things.
Yeah, I had the opposite, Barbara, right? I said, please don't open it yet. Please don't open it yet. They didn't delay.
Great. Could you guys let us know, are you aware of any related research on rural transit systems?
Yeah, it's an excellent question. I'm aware of other light rail studies, but none of them are in rural areas. There's one in Houston. I don't know of any offhand.
Transit, especially light rail development, is so expensive that, typically there are density requirements before those lines are built. So I think in rural areas, you're looking at jitney services or bus services. I just don't know of people who've been studying those, sorry. I mean, Brownson did some of the trails in Missouri, walking trails, but not transit lines.
All right. Our next question, we're almost coming to the end of our time today, but again, if you do have questions, feel free to send those into the question pane, and we will pull those together and then get them answered and posted online after the webinar. So this may be, depending on time, our last question. But for the both of you, on a more broader level, how well do you think the field is progressing in terms of conducting more rigorous natural experiments? And do you think that there is a discrepancy between the quality of the evidence and current policies in place in relation to implementing transit for the purposes of improving physical activity?
I guess I can go first. I do think that some of the measures have improved our rigor. I mean, in some sense, it's challenging because we're at the whims of decision makers about how much or what transportation infrastructure is actually being moved forward. One of the things that we've heard from folks is, even if you document that, this transportation infrastructure changes this health or this physical activity parameter, that's not what decision makers are really interested in. There are other reasons why you'd want to improve transit and transit access. So this might be an additional piece that facilitates maybe better transit. So I do think the rigor of our methods with these quasi-experimental designs is getting better. But it's got to be combined perhaps with other outcomes as well. And we've certainly heard that, focus on air quality or health costs. So we, as well as other folks, are looking into those outcomes too.
And I agree with Brian that the methods are getting stronger. I mean, I don't think we'll be tied to correlational studies as much as we had been in the past, and I think that we're getting beyond self-report. And I also agree that there are other benefits that are important to society, and it's a challenge that any one agency doesn't have responsibility for all of those benefits. So I know there are efforts to talk about health in all policies, so trying to revamp all policies to have a health slant to them, and that would be great. It's possible that studies like these can spur that kind of thing along, so that we do look at the broader picture. Even if the transit planners are not responsible for public health, maybe there's ways to incentivize them to think about public health and to think about new ways to get all the pathways to transit stops to be walkable and good ones.
Great. Thank you very much. I think at this time we've run out of our time for today's webinar. So on behalf of Active Living Research, I would like to thank everyone for participating in today's event. I would especially like to thank both Brian and Barbara for the presentations and efforts in studying transit and physical activity. We hope that our webinar attendees will be able to apply what you have learned today in your own research. And I would remind you to be sure to check out the resources available that are on the Active Living Research website. And please remember to complete the webinar evaluation survey that you will receive shortly. And again, the recording of and slides and question and answers of the event will be posted on the Active Living Research website. So this concludes today's webinar. Thank you and have a great rest of your day.
Thanks, Chad.